Public health physician Dr Nina Scott scathing about how badly Maori men with prostate cancer are being treated.
If we know there are inequities and we don't try and fix them, then that's institutionalised racism, so that's inaction in the face of need.
She's part of a 3-year joint University of Auckland and Waikato Clinical School prostate cancer study. The results show the medical treatment Maori men receive is failing them.
Māori are 19% more likely to be diagnosed with cancer than non-Māori, but about 80% more likely to die from cancer than non-Māori. And between diagnosis and outcome is treatment. And there's a lot of inequity, there's a lot of unfair differences going along that treatment pathway.
Dr Scott was also part of the task force set up to advise the Ministry of Health on prostate cancer care. Its recommendations will form a new framework of care. Controversially, it doesn't include a national screening program, but does include an admission of inequity.
We can react with evidence to those people going around blaming Māori men for some kind of cultural problem about not wanting to go to the doctor, which is actually just rubbish and it's racist.
Associate Minister of Health Tariana Turia says the government can no longer ignore the evidence of racism in the health system.
There are many health reports that are coming out right across the spectrum that are clearly indicating that there is a bias. Now, we could call it racial bias if it makes people feel better, but the truth is this is about active institutional racism.
The government will spend $4 million from this year's budget on improving the system and on a publicity campaign. Dr Scott says Maori men don't have to die at a greater rate if there's a change in the way they're being treated. Carmen Parahi, One News.